My name is Cluzie Pierre. I am in the family nurse practitioner. For my final pocket guide blog, I use a 3-ring binder with 8 separated sections. Which has the list of 8 pocket guides. Each section contains the most important information regarding the topic. Some guidelines and the reason that made the information relevant. I learn and remember better by using the most important information. The information is organized in terms of questions and answers, which is pinpointed with bold font and bullet points in order to help me visualize, focus, and remember. My final pocket guide will help me during my clinical rotation and later in my practice, for my practice. My first pocket guide on community acquired respiratory condition. Even though this condition may appear banal, is a serious condition that can be life-threatening. It is crucial to obtain a complete history and subjective objective data. The confirmation of diagnosis can be made with chest radiography or ultrasonography. It can be treated empirically according to the new guideline. My second pocket guide on contraceptive management is a complex one. Appropriate options such as non-hormonal like abstinence and hormonal like progesterone are underlined and placed in 2 categories. When it is appropriate to use emergency contraception and permanent method are emphasized and identified 2 distinct tests. My third pocket guide on hypertension and hyperlipidemia is vital because high blood pressure is costly and considered as a silent killer. Aggressive and presentative measures should be used. Remember the guideline for screening. Lifestyle modification is a strong recommendation. Remember the best way of treating diverse patients with appropriate medication and when to refer them. It is important to remember also the guideline for hyperlipidemia, ignoring some cardiac risk factor, the importance of lifestyle modification, and be familiar with the use of drugs for dyslipidemia, such as first, second, third line of treatment. My fourth pocket guide on hepatitis is significant because it represents a public health concern, not only in the US but also around the world. And the vast majority of infected people are unaware of their condition. So it is important to be familiar with the symptoms, some type, transmission, risk factor, and diagnosis testing. Remember that treatment is mostly supportive and also the preventative measures like vaccination and recommendation, and knowing when to refer the patient. My fifth pocket guide on anemia is relevant because anemia represents a health concern and a growing problem in the US, and its primary cause is iron deficiency. Be familiar with the definition, some causes, some characteristics, signs and symptoms, some relevant terms, and how to classify, quick investigation, and way of approaching different types of anemia. The next pocket guide is on thyroid. It is important to me and interesting because for medical and personal reasons. Thyroid disorder is more frequent in women, and an important number of people will develop it during their lifetime. So it is important to know about different types of thyroid hormone and also abnormal function and growth. These two tables help me to do the comparison between hypothyroidism and hyperthyroidism in terms of signs, symptoms, and causes. Know how about diagnosis testing and when to refer. In children, it is important to know that hypothyroidism is most common and can be asymptomatic. My seventh blog is on men's health. It helped me have a better understanding of some disorder in men like benign prostatic hypertrophy, prostate cancer, erectile dysfunction, low testosterone, kidney stone, epididymitis, and prostatitis. The reality is mostly men doesn't like to go to primary care. And also in most of the country, this is why their life expectancy is decreasing compared to women. It is important to differentiate in terms of BPH. It is important to differentiate between first and second generation of alpha blocker. Knowing about prostate cancer, erectile dysfunction, and low testosterone, and know about how to monitor them and when to refer them, and mostly if you are uncomfortable. Epididymitis and prostatitis are discussed also. Include what are the symptoms, laboratory tests, differentiate with torsion, and how to treat. A table helps you differentiate between acute prostatitis and chronic prostatitis. My eighth pocket guide on benign gynecology contains information on endometriosis, uterine fibroid, ovarian cysts, and kidney stone. It is interesting to learn also that women can be empowered and also they have potential to improve their health and decrease their risk factor. For endometriosis, it is important to know about pathophysiology, cause, relevant factor, and symptom. The treatment can be conservative or definitive. Uterine fibroid and ovarian cysts. It is important to know how to classify them, some subjective and objective finding, how to treat them, and refer them to the surgeon, and to do the follow-up. Also, torsion and kidney stone are also discussed in this pocket guide. Overall, my blog are organized in the best way to convey the complex and intricate facts relevant to various conditions. This knowledge is accessible and understandable with ease, and it is conveyed through use of bullet points, tables, questions and answers. This guide will bring much benefit to my experience in the clinical field.